I wanted to give you guys some tips on how to survive nursing school as a first year student.
Young and fine and dark and handsome, the boy from South Detroit came on singing. I can't keep my panties from dropping. He's so fly, fly. Moving so fast, don't hurt yourself. I can't keep up with all.
Yes. Okay. Hi guys. Hi guys. Hi guys. Welcome back. Welcome back to my YouTube channel. Ooh. Welcome back to my YouTube channel, you guys. You guys. Immediately, like my shoulders are heavy. They're so heavy. You know why? Yes. Let it sink in. You know that sound? Yeah. I'm not with Metro anymore. I am with AT&T. That is me. Let me show you my old epaulets. I don't even know how to. Nikki Bailey Mokai. There's supposed to be somewhere in here. Yeah, there should be. Woo. These are my old epaulets from last year. Ne? Dreadful. These are my new ones. Luna, like, you know me, if you would have told me 2 years ago or 3 years ago that I would be here, I would believe you. I would believe you because I'm one person that strives, okay? I strive. So, without further ado, hi guys, my name is Precious. I'm a lifestyle content creator. I'm a second year nursing student. I love fashion, I love makeup, I love skincare. So if you do know anyone who is around who loves content like that, tell them about me. Like, tell them about me, you know, so that we can grow this beautiful family together, because I wouldn't be here without you guys. And to my beautiful subscribers from day one, I want to say thank you. You guys know me. If you've been following my TikTok, my Instagram, my Facebook, you would know. I'm gonna list them down below so that if you wanna go check them out, please do. Okay. Alright, so guys, today I got my second stripe. That means it's more responsibilities, it's more accountability. It's basically having, now I'm no longer a baby in nursing. Okay, so yeah, I am so happy, but I wanted to give you guys some tips on how to survive nursing school as a first year student. And whatever that I'm gonna say, just a disclaimer, it's not a reflection on SANC, it's not a reflection on the Department of Health or my employer. Okay, it's just my personal opinion based off of my personal experiences from last year and the experiences of some of my colleagues that have given advice. All right, let me just get my book. It's so hot, you guys, ne? Like, it's so hot. So so the first thing that you're gonna do, okay, you are going to have time management. Time management is key because you have to plan. All right, you have to plan your time, you have to plan your study time, you have to plan your self-care time, you have to plan your clinical time. Okay, hello, I'll be with you just now. Sorry about that, guys. Yeah, I was just busy with my little sister. Time management is key. Okay, time management, learn your study schedule as a whole. Know that this week I'm doing this and this, so that you can prioritize your time, right? You can prioritize, okay, when I go back home, I'm gonna study for 2 hours this, I'm gonna study for 2 hours, and I'm gonna practice one so and so. Okay, second step is that don't cram. There is nothing that you're gonna gain from cramming, because remember, you're dealing with patients' lives. Okay, I'm sorry about this as well. I'm not sure if you guys can hear it, but if you can, I'm sorry about that. if you're gonna cram, then there's no point, honestly, in you trying to, like, I don't know, but don't cram. Rather learn it, study it, so that you can understand it and know how to apply it. Thirdly, clinical prep is very important. Okay, make sure that you're prepared, especially when you're doing a procedure, any procedure. Make sure that you're prepared, meaning that if you're doing patient identification, you have to have your ID bands. If you're doing vital signs, you have to have your Dynamap. You have to have your temperature probe. You have to, like, a thermometer. You have to have your second-hand watch. Okay, that is a must. Okay, good, because you can't cram something, you can't guess somebody's respiration. You have to use your second-hand watch. That is why this is where professionalism comes in place. Professionalism comes in place, especially in your uniform. You have to look presentable, you have to look clean, you have to look like a professional figure, because you are going into a professional practice. That means your uniform must be clean, your uniform must be clear, your name badge. Okay, you have to, because every patient has the right to be nursed by a named professional. Okay, another thing that is important is self-care. Okay, you are not gonna get anywhere if you always focus on one thing, if you always on your books, and because it can get overwhelming. Okay, it is overwhelming, and it's okay. The one thing that I'm gonna tell you is that self-care is important. Go out, like, not go out every week, once in a month. Go out, have lunch. Okay, de-stress, something that you will cope with. Okay, so self-care is very important. I normally, what I love to do is I like to go shopping. I like to go even eye shopping. I don't have to buy anything, I just have to be out of the house. Okay, and with self-care comes coping mechanisms. Okay, knowing how to cope with stress, knowing how to cope with the pressure, knowing how to cope with not overwork, but all of the work that's been given to you. It's very important that you learn how to cope with everything. All right, you guys are still following me? All right, make sure you have a support system, you guys. Having a good support system will help you. Having friends and like that are already nurses, or that are nursing students that know what you're going through, have a good support system. All right, and in class, you don't have to like everyone, but you have to be cordial with everyone. You have to make up with everyone. You have to understand each other so that you can help each other, because you're in the same boat at the end of the day. All right, okay, things to ignore. Don't under prepare for your clinicals. Firstly, even your theoretical practices, even your test or your classes, don't under prepare, because you're now going to say, okay, today we're doing empathy, sympathy, and you only learn sympathy and not empathy and compassion fatigue. No, prepare. Even when you're doing a procedure, prepare. I prepare with my family. If I'm gonna do a blood pressure or a respiration, I'm gonna take my family and put them down. I'm like, okay, I'm gonna learn with you guys, because I need this, I need to pass. All right, so yeah, do not failing to rest may lead to burnout. Okay, like I said, you need to take care of yourself also. Even though you do take care of patients, you do take care of your friends, you do take care of your family, don't forget that there's a you also. You're also an individual that needs to be taken care of, and if you don't take care of you, you're gonna crash out and burn, and that is not nice. Okay, another thing is that don't be a miss I know it all. I know it, I know. Learn. Okay, if you are humble enough, if you are humble, like, be humble. Learn. Don't say, no, I know this, no, you're not supposed to do this. No, learn, especially in your clinical settings. You guys, remember, you have old nurses like that did the old curriculum and whatnot, and they have a system of how they do things. So when you get there, yes, make your voice heard, be assertive and whatnot, but don't be a miss or Mr. I know it all. Okay, be willing to learn. They like that. If you're willing to learn, they love that. They will print you stuff. They will do this, they will do that. Understand? Good, good. And also, when you're in a clinical setting, oh, it's hot. In a clinical setting, it's okay to make mistakes. You're not gonna get everything correctly on your first try. Even your second try, you're not gonna get it correctly on that go. There are people that can get it correctly on that go. Mara, we're all made differently. We all learn differently. And it's okay to make mistakes. Just ask for help after that. Because asking for help is the best thing that you're gonna do for your life. Ne? Carry a notebook so that you can make some like tiny notes, like a small notepad. I think a pep it's around 10 rand. Yeah. And reflect. At the end of every clinical block, you have to reflect. Not for the college or the university, for yourself. What did you learn? They have a strategy on how you can reflect. They will give you maybe someone that has a model of reflection, and you have maybe follow that one. Okay, because reflecting will help you to see how far am I growing in my career? Am I growing? Am I not? Am I learning? Am I not? Okay, so you need to reflect, and I hope you guys do. All right, I'm just gonna have water a bit. Is it still alright? It's still shooting. Okay, so I hope you guys still are following me, are following what I'm saying, and you subscribe. Subscribe to the channel, because our girl is getting somewhere. I'm at 82 subscribers. Can you believe it? Can you believe it? So today I went to school. I got my second stripe, and then I went to PEP. So this is my little sister's bottle, and I like. I'm so sad that I couldn't get it in pink. So sad, so sad. And I'm gonna post this video. I don't know when. Because I wanted to show you guys something. But it's okay. It's okay. I'll show you guys on my next vlog, because it contains a present. And I don't want this person to see this present beforehand, before I give the present to that person, to the love of my life. I hope you don't see this. So yeah, I got this bottle from PEP. It was 150 because I am moving from home, and even though I'm excited, I am nervous because I'm gonna leave my mom and my little sister here, and I have separation anxiety, so that's not gonna be nice. Yeah, so I am moving at the end of the week. Yeah, that's all I have to say for now. I am gonna show you everything when I move, when I get there, how I decorate the place. I got this fabulous, it's just not in my room now, this fabulous pink and white bedding that is so cute from PEP, and I hope you guys love it. This home makeover. All right, so I hope you guys have listened to all of the advices that I gave, the tips that I gave to you guys. I hope you guys did enjoy this video. It was a sit down video. It was a sit down video, and then I hope you guys enjoyed it. I hope you guys, if you reach this far, like you love me, you love me. So yeah, I'm gonna start a new vlog probably tomorrow, but until then, let me love and leave you. Bye.